So Royal Wolverhampton is a vertically integrated system. We have 70,000 or so patients, but we cover many more across Wolverhampton and the wider Black Country. We work very closely with our own public health department and the local council on health and wellbeing too. So adding Babylon to that mix creates something very unique, which we hope we can learn from and provide a much better offer for patients.
We've got some of the best doctors and nurses in the world. We are not the best technologists, so you go with the best.
I'm very biased about Wolverhampton New Cross Hospital. I've been here for 10 years doing voluntary work, and I constantly see innovation in the hospital. Things are working well, and we're one of the best hospitals in the country.
I think that this will be a real step forward for healthcare, and there will be enormous benefits to clinicians, and then in turn that will benefit patients.
Working with Royal Wolverhampton is going to be very exciting, not only for us as Babylon, but also for the staff, and of course most importantly for patients. It'll be so much better for patients when they can go to a resource where they can find out if what they should do is go to A&E or book an appointment with a doctor, or maybe go and see a pharmacist, and make sure that the first step towards getting better is the right step.
At one time you're dealing with one department, then you're dealing with another department and different doctors, all very supportive. But if there's a central point of information that's accessible by everybody at all times, it's going to make it a lot easier, I think.
It really is a transformational partnership between one of the strongest NHS organisations and Babylon as a global digital technology and clinical services provider.
For patients, there's a self-care transformation. So I'd hope for about 40% of current consultations to be done in the patient's own home, where the patient has greater control over their own healthcare. But for the NHS as a system, if this works, the savings will run into the billions if this is transposed to different parts of the country. In 10 years' time, we will have a model that is, I think, the best in the world. I'm genuinely massively excited.